Everyone right? Very good. Thank you for coming along. I've been joined by the Chief Health Officer to update the community on a positive case that has been confirmed here in Victoria. This morning, the Department of Health was alerted to a positive COVID-19 test result and immediately initiated a full public health response. This is what we know about the case so far. The individual is a male in his 30s. He recently returned to Australia from overseas on the 19th of April. He undertook hotel quarantine in South Australia, and I note that our colleagues in South Australia Health have made a statement this afternoon about his potential exposure in South Australian Medi hotels in that state. He arrived in Victoria and returned to his Woolart home on the 4th of May. He developed symptoms on the 8th of May and took a test yesterday. The department was notified of the positive result this morning, the 11th of May. The department has arranged for further urgent testing to confirm that diagnosis. That retest has come back early this afternoon and is been declared a positive case. We have urgently tested the 3 household contacts, and the good news is that all 3 primary household contacts have returned a negative test result. Preparatory actions were well underway should any of those primary close contacts have tested positive, but as they've all tested negative, those preparatory actions are now being progressively stood down. The following are the initial exposure sites listed to the positive case announced today, and these may well change in addition to the ones I'll take the community through. Starting with the Tier 1 sites. If you have been to any of these locations during the time indicated, you need to immediately isolate, you need to get tested, and you need to quarantine for 14 days. You also need to contact the Department of Health Coronavirus Hotline on 1300 651 160. And there are 3 Tier 1 exposure sites at the moment. Firstly, the Melbourne CBD, the Curry Vault Indian Restaurant and Bar at 18 to 20 Bank Place between 6:30 p.m. and 9:30 p.m. on Friday the 7th of May. Secondly, in Epping, India Gate Spices and Groceries at Unit 14C, 560 to 590 High Street, Epping, between 5 p.m. and 6 p.m. on Saturday the 8th of May. Epping Woolworths, and that's on the corner of Cooper and High Streets in Epping, between 5:40 p.m. And 6:38 p.m. On Saturday the 8th of May. Then to Tier 2 sites. If you have been to any of these locations during the times I'm about to indicate, you need to immediately isolate, get tested, and stay isolated until such time as you receive a negative test result. You also need to call the Coronavirus Department of Health hotline on 1300 651 160. There are also 3 Tier 2 exposure sites. The first is in Altona North, and it is the TIC Sometimes that's through things they might have overlooked or as details need to be corrected. But the important thing is to get this information out to the people of Victoria as soon as we possibly can, so they can take steps to keep themselves safe and keep their community safe. The full list of exposure sites is on the Department of Health's Facebook site now, and will shortly, if it's not up already, be at the coronavirus.vic.gov.au website. You can also look for areas in which you can be tested at the coronavirus.vic.gov.au website, and there are many locations accessible right across the state. Can I take this as an opportunity just to remind Victorians that this global pandemic is a long way from over. If you have any symptoms of COVID-19, a fever, a cough, sore throat, runny nose, chills or sweats, or a change in your sense of smell or taste, you need to get tested immediately. It is the most important thing you can do to keep yourself safe and to keep your community safe. Contact tracing is well underway, and we will keep Victorians updated on the outcome of this. As information comes to hand, we will share it. We are also working on a communications effort to get the word out about exposure sites and the need to get tested, particularly in the different communities in Melbourne's north. We're undertaking radio live feeds and social media activity in multiple languages right across Melbourne, but again, particularly in Melbourne's north. We're engaging with community leaders, as we have done in earlier outbreaks. And we will be sending out mass text messages through Emergency Management Victoria to those suburbs where exposure sites are located. We are continuing to work with other states and territories on the sharing of necessary information around this gentleman, particularly our colleagues in South Australia, and the Chief Health Officer will be meeting his interstate counterparts at 4 p.m. this afternoon to continue that process. This case is an important reminder that we are still in the grip of a global pandemic. And one of the most important things that you can do is to get yourself vaccinated as soon as possible. If you are eligible to get a vaccination, please do so as soon as you can. Book yourself in to one of your local participating GPs who are leading the vaccination program in this state, indeed in the country. They're doing an outstanding job. Or come along to now one of 28 open access sites that the Victorian Government is running right across the state, and which are more than capable of handling you. Phone the coronavirus hotline, or take your chances and walk up. But they're open access for that very point, to be as accessible as they possibly can be. Victorians know that we can manage this. We've done it in the past. We can run this to ground. We can only do that, however, if all Victorians do their bit. And that involves following COVID-safe behaviours, such as checking in at all venues, encouraging your friends and your family and your mates to do exactly the same. Record keeping is critical to success in running down these cases. Wear your masks where it's appropriate, and as I say, if you show the slightest symptoms, get tested and do your bit to keep Victoria safe and to keep Victoria open. Happy to take questions.
Where did the man come from overseas? Was he from India before he came back?
My understanding is the gentleman departed India via the Maldives through Singapore into Adelaide.
You did mention the flight he took to get from South Australia to here. Does that mean you're not concerned about that flight?
I know we're working with the National Incident Team data about that. So there'll be judgments made. I might get the Chief Health Officer to add to that, but there'll be judgments as to when he was infectious, and that will be based on the outcomes of the serology and genomic sequencing work that's underway, sharing that with what the South Australian working hypothesis is, that he might well have picked this up during the hotel quarantining in Adelaide, and then working backwards from there. So this is very much a first iteration of exposure sites.
When do you expect to have genomics back showing whether or not there is indeed that link to the person who was next door to him in the South Australian hotel?
I might let the Chief Health Officer address that.
Certainly we get genomics back very quickly nowadays, but for a comparison, I'd have to see what the South Australian case genomics shows and whether that's already through.
They said at their press conference 30 is so, and it's a matter of us getting ours back.
Yeah,
So
I imagine it's a matter of a couple of days maximum.
How concerned are you about the spread of this man throughout the suburbs, or is the concern low at this point?
Oh, we're always concerned about the prospect of transmission. That's why everyone needs to do the right thing all of the time, but particularly reflecting on these exposure sites to, as the Minister says, be prompted to test if they're in Tier 1 sites and to quarantine for the full 14-day period, and if they've gone to any of those Tier 2 exposure sites to test and await that negative result. The thing about this virus, there are some individuals who pass on to no one else at all, and there are some individuals who pass on to several people, and you can't tell at this stage how infectious those individuals will be. So you really have to work on the presumption that transmission risk is there. It's an early encouraging sign that the household close contacts are tested negative, really on the basis that he's obviously been at home with them and symptomatic since the 8th and probably infectious from the 6th. We're now at the 11th and there's been no positive cases arise, but that's not the full incubation period. So it may well still be that some of those close contacts test positive. That gives an indication of the infectiousness of the individual, and then we would really be pushing the message for anyone who's, especially around Wollert and Epping areas, to be absolutely alert to symptoms and getting tested.
Just working on that hypothesis, presumably that's the most likely case that he was infectious from the 6th. How does that play into the timeline with regards to flights and Tier 1 and Tier 2 with this scenario?
Yeah, on face value, the flight is unlikely to be something to chase up. The 4th is not a day that we expect him to be infectious, but with variants of concern and with the evolution of this virus all of the time, we have to be alive to the possibility. We'll go through that interview and re-interview process with him, but we think the onset of symptoms were on the 8th, so infectious for 48 hours prior to that.
So presumably that means that it's extremely unlikely he didn't get it any other way except for the person in the room now.
Oh, I think it's absolutely the case that he's picked it up in quarantine in South Australia, but we'll see what other potential exposures might exist.
So does he have close contacts other than the family members, and are you guys going to employ a third ring approach in this outbreak with contacts of contacts being asked to isolate?
Yeah, we are. So the contacts of contacts is absolutely our approach. They get cleared if they're contacts, if those primary close contacts test negative and they've separated from the secondary close contacts. In terms of other close contacts, not that I'm aware of.
Could more come about, or is that interview done and there are no close
No, we
contacts?
will always go back to interviews and provide prompts. There might be some reminder that triggers a potential close contact.
And did he breach the, it's your understanding that he breached the rules of the India travel ban because he was in India within 14 days before coming here? Did he take
No, that was not in place. So he arrived in South Australia in mid-April. So.
Oh, right.
Not through what has previously been described as the back door as such.
No. It was a flight that was, as I understand it, expected and routine into South Australia.
So is that Citadel Health, was that part of that third ring? So that's already been born as a third ring?
I imagine so, yeah. I haven't got all of the details for those sites that are progressively being cleared, but when those secondary close contacts test negative, they are those Tier 2 sites that get cleared.
And at this stage, you're not foreshadowing any restrictions or public health measures?
No, we're not foreshadowing anything. The good and recommended advice is good advice for all times. People should wear masks if they can't physically distance from others, especially in indoor settings. We know that it's mandated on public transport, airports, ride-share vehicles, so people should absolutely follow those rules. The other key thing is checking in with QR codes, as the Minister and I have done coming into this room, and as I do everywhere I go. Everyone should do it all of the time. You just don't know where a case might pop up, and you want to be able to, provide that clarity on exactly who was in close contact when someone's infectious.
Will you start looking at that QR data for some of these exposure sites?
I'm sure it'll be worked through as soon as it's been made available.
There have been concerns in recent days that some venues and a lot of Victorians have sort of been become a bit slack about that. Is that a concern you have, given that we haven't had a case for a little while?
Yeah, it is. I think it's a concern across Australia. There's definitely a sense of complacency creeping in. We have been protected. We haven't had really significant outbreaks for some time, and people drop their guard. People go about life as if we haven't been through the 15 months that we've all been through. But it is a reminder that we need to be on guard, and this is our protection for now and into the future.
Does interstate hotel quarantine need to lift their game a bit when it comes to airborne spread, do you think?
Look, I don't know the specific circumstances. There'll obviously be a root cause analysis in this case. What I'd say about hotel quarantine is that in the same way that Victoria's been on a really intensive review and learning journey with quarantine, as for so many aspects of the response, that needs to be a national process for every single quarantine setting, whether it's with regard to ventilation, to the testing regimen for those who are resident in hotel quarantine, the testing regimen for staff in quarantine, the vaccination which is mandated for CQV staff in Victoria, and then the vaccination of family members of quarantine staff. There are so many layers and layers of protection that we need in quarantine, because it is clearly our primary risk area, given that we've smothered community transmission down to zero.
Stephen Wade, the South Australian Health Minister, said 2 hours ago that their hotel quarantine system is nation leading. Is he wrong?
I'm not here to comment on another jurisdiction's view of their own quarantine. I'm not intimately familiar with it. I would say we need to take all new incidents, all new information as a learning opportunity, not just for the jurisdiction that's been involved, but for everyone across the country. We're doing that. I'm sharing the information that we've got through our review processes nationally, and there will be continued lessons to be learned.
The COVID positive man who moved into the room next door to this guy on May 8, he was clearly moved into this hotel because it was a place where positive cases could go. Do you understand why
They call all their hotels.
So why was the positive case moved there on that day?
He moved out that day.
From a home or something?
Sorry, Martin, do you mind coming to the podium?
This is all information that the South Australians released, as I understand it, so I don't pretend to speak for South Australia. So my understanding is that the gentleman in Melbourne who's tested positive was the next door neighbour in what the South Australians call a medi-hotel, which, as I understand it, is a hotel quarantine facility. And that the gentleman next door to him tested positive, and the day he was tested positive is the day he got relocated from that medi-hotel to another hospital hotel. I think it's in the title, is my understanding, but I'm not an expert on the South Australian hotel quarantine system. To follow up one of the earlier questions, all the health ministers work in a hugely collaborative way, and we all share learning experiences, and we all share the experiences of having seen now, I can't remember how, I don't think I've got enough toes and fingers to count the number of times that we've seen the virus leak out of hotel quarantine right across the country. as the South Australian Minister indicated when I heard him speak, saying that there is no such thing as a foolproof hotel quarantine facility, which is why this evening's national budget is a golden opportunity for the Commonwealth to step up and do its constitutional duty and fund with the states broadacre quarantine facilities such as that proposed by Victoria out of Mickleham. There are example after example of the leakage out of hotel quarantine that continues, and this would appear to be another example. And there's every indication that we're going to be in a position of some form of closed borders for many, many months, if not years. Yes, we need to make sure that we get as quickly as possible to the highest level of vaccination programs, but with variants of concern, with the need for likely top-ups in vaccination programs, we are going to need a strong border control and a strong quarantine control, likely for years. And we cannot continue to have a situation where it is the states disproportionately bearing the load in this quarantine process. And tonight's budget is an opportunity for the federal government to step up and do its bit and see to its constitutional duty of managing quarantine in partnership with the states and fund the Mickleham proposal.
How hopeful are you that that will take place? Have they given you any hope that they are considering that proposal?
Well, I was quite buoyed by the Prime Minister's positive comments last week, and in the conversations that health ministers regularly have, we've been quite buoyed by the positive comments that we've had from health officials. But the proof will be in the budget tonight. Victoria has a really considered proposal on the table. We're asking the Commonwealth to pay for it. It's scalable, it can be built up, it can be used ultimately for other purposes, but at the same time Victoria has committed that it will operate the facility. That's a pretty good partnership model that will keep the community safe.
Just back to my earlier question, maybe one for Brett, about not having introduced restrictions at this stage. Are you starting to factor in behind the increasing number of vaccine doses administered?
No, not really. I mean, the job that Victoria's done in providing vaccines has been terrific. I think I saw over the weekend as many vaccines administered in Victoria as in all other jurisdictions put together, I think on Sunday. But it's not enough, and the coverage of vaccines at this stage does not really change the speed or spread of any virus, variant of concern or not. It'll get there, but it won't get there until we've got 60-70% coverage, and we're a long, long way from that at the moment.
Do you have the flight number of the man?
I don't have the flight number, sorry, Bridge.
Are you taking
Last question, please.
something of a gamble by not listing the exposure sites from the day he arrived and the flight and sort of 2 days after he arrived? Is that a slight gamble, or are you 100% sure that he was not infectious during that period?
Oh, nothing's 100% sure with coronavirus, but we're doing we're taking the approach as per the national standard that every other jurisdiction takes.
So why are you not listing exposure sites in the flight number now?
So we're not listing exposure sites that don't relate to the infectious period, but as soon as we've got additional information of relevant exposure sites, they'll go up, no question.
But do you believe the man was infectious in the community for 5 days?
We believe that he was infectious for 48 hours. We work on the presumption that he's infectious for 48 hours prior to developing symptoms, and then obviously up until the time that he's isolated with his positive result.
Are you concerned about the strain that he might have?
Yeah, certainly every strain now seems to be a variant of concern. They are of concern for different reasons, either because they're more transmissible or because they can evade the immune response in one way or another. The common variants that have been in India have been the B117 that was originally identified in the UK, which is more transmissible than the historical coronavirus, if you like. But the one that has taken over in India, the B16172, appears to be at least as infectious as that, and potentially even more so. That's an awful prospect for India, and Indian Australians more than anyone are aware of the unfolding tragedy. But we can defeat these viruses through the basic public health principles of isolation and quarantine, the contact tracing and the testing that is part and parcel of that. So yes, it's a concern in terms of how many people might get infected, but the principles still apply and they are still successful when applied broadly.
Do you have an update on his condition, and will he stay at home or will he be transferred to?
I don't have an update on his condition, sorry.
And this might be more of a question for South Australian authorities, but do we know where the case that we think this person caught the virus from had travelled from, where they'd come from overseas?
Yeah, it's probably for South Australian authorities.
And is testing being ramped up? Sorry, Dana. Is testing being ramped up near some of these exposure
Yeah,
sites?
there'll be increased capacity for testing, but we're well within the capacity limits for testing in Victoria. You know, we've routinely had 15,000 tests a day. Again, you know, pretty good baseline levels, but it's still not enough. Only about 25% of symptomatic people report getting tested in our routine surveys. I want that to be 100%, and especially going into the week ahead, everyone in that area, everyone across Victoria who's symptomatic really needs to come forward for testing.
Can I just ask one more, sorry? Did the man go to any private gatherings over the weekend or family gatherings that are not listed because they're not public spaces? Was he in any
Nothing I'm aware of at all.
When you say aware of, has the interview been fully completed? Will more exposure sites potentially come out tonight or tomorrow?
So I don't have all of the information from the interview. Obviously the information that's been transmitted to me for the purpose of letting you guys know lists all of the relevant exposure sites, but I haven't been informed of any other private gatherings.
Is that just because you need to get out at an earlier time in the afternoon, or why don't you have all the information?
No, I'm saying there is no information that I have that relates to private gatherings.
Okay.
It may well be that there are none whatsoever.
How likely are that we'll see more cases, considering he hasn't passed it on to his family?
It's a very random process with single individuals. You can see one person who spreads to 10, and then you know the next 5 cases, despite going all over the place, transmit to no one at all. So there is some luck of the draw with coronavirus, but we have to work on the presumption that he's infectious, and that everyone who's been to these exposure sites needs to test and quarantine as required.
Are you treating this as a local case, and does it end the 72-day streak?
No, it was clearly, it seems like it was acquired in South Australia. It's obviously been tested, but it'll go down as an interstate case if that's confirmed.
So the streak stays?
For local transmission, it does stay. Look, that's great for Victoria, but the challenge is there regardless.
Sorry, just the Altona North warehouse, is that his workplace and what have
Oh, look,
colleagues been told?
it wouldn't be for me to reveal private details, but it's a site that is a Tier 2 exposure site for visitors for the whole day as listed. Thank you.
Thank you.
Thanks, Sandra.